Good afternoon, folks. Now, today's discussion A kind of runs into other shows I've done this week about uh, England's assistive dying legislation. So we're going to look at the same information, but we're going to look at it through the clergy's side, like bishops from England, how they view assisted dying. So please join me for today's presentation A. Okay, the title is Bishops Risk Legitimacy by Standing in Way of Assisted Dying, ex-church leader. Lord George Carey, a former Archbishop of Canterbury. Okay, we're going to go through how he feels on the whole issue. So, and then I also threw in this presentation some parts of the U.S. have laws for assisted dying for terminally ill people. So I'm going to go through that end of it also for today's A. So please join me in today's presentation. Here we go. Title: Bishops Risk Legitimacy by Standing in Way of Assisted Dying, ex-church leader. Key points: Lord George Carey, former Archbishop of Canterbury, publicly criticized Church of England bishops and House of Lords peers for opposing the terminal ill adults end of life bill. He argued that their resistance underestimates both the church's and the Lord's legitimacy in public life, especially given strong public support for assisted dying. Carey emphasized that the bill had already passed the elected House after. Give me 1 second, guys. Extensive scrutiny. And predicted it will eventually become law. He challenged religious leaders to reconsider their stance, suggesting they are not representing the broader church or societal views. The debate reflects a broader identity crisis with both the church and the Lords regarding their role in modern society. If you'd like, I can help you map this to broader ethical, policy, or cultural frameworks, especially around aging, autonomy, and end-of-life care. Assisted dying raises profound ethical questions that touch on autonomy, compassion, justice, and sanctity of life. Here's a structured overview of the key points. Okay, guys, give me a second. I'm gonna get these apart. Okay, straighten these out. Ethical implications drawn from current debates and global perspectives. Ethical arguments in favor of assisted dying. Respect and respect for autonomy. Individuals should have the right to choose how and when they die, especially in cases of terminal illness and unbearable suffering. Voluntary euthanasia honors informed consent and personal dignity, compassion and relief from suffering. End of life may be seen as a merciful act when no other medical interventions can alleviate pain. It can offer more humane alternatives to prolonged suffering or passive dying. Justice and fairness. Patients already have the right to refuse life sustaining treatments. Assisted dying extends that right to those not on artificial supports. Treating like causes like means offering uh, consistent options for end of life decisions. Ethical arguments against assisted dying. Sanctity of life. Life is considered inherently valuable and interna- inter and intentionally ending it, even with consent, may violate moral or religious principles. Critics argue that legalizing assisted dying could erode societal respect for life. Non malicent mal maleficent do not harm. Physicians are ethically bound to heal, not harm. Assisted death may conflict with other professional obligations. Some fear it could com- uh, compromise the trust between patients and healthcare providers. Risk of abuse and slippery slope. Concerns about coercion, especially among vulnerable populations, e.g., elderly, disabled, or not, or economically disadvantaged. Legal safeguards may not fully prevent misuse or pressure from family or institutions. impact on medical practice and society, could shift the role of medicine from healing to facilitating death, might influence societal attitudes towards aging, disability, and chronic illness in problematic ways. Global perspectives. Countries like Belgium, the Netherlands, and Switzerland allow assisted dying under strict conditions. Emphasizing mental competence and consent. In the US, states such as Oregon, California, and Washington have legalized physician assisted suicide with religious safeguards. Other regions maintain strict bans, citing ethical and cultural concerns. If you'd like, we can explore how these ethical dimensions intersect with culturally responsive care, role aging, or policy frameworks, especially in contexts where autonomy and equity are contested. The legal land the legal landscape of assisted dying varies widely across the global shaped the no the globe shaped by cultural, ethical, religious, and political factors. Here's a structured overview of where things stand. Countries where assisted dying is legal. These nations permit active euthanasia, a medical professional administered life ending medication, or physician assisted dying, a patient self administered prescribed medication. Con- uh, Country legal status, key conditions. Netherlands legal since 2002, must be voluntary, well considered, and involve uh, unbearable suffering. Belgium legal since 2002, includes minors with terminal illnesses and mental illnesses under strict review. Canada legal since 2016, expanding to include non terminal conditions known as MAD. Colombia legal since 2015, constitutional court ruling includes non terminal cases. Spain legal since 2021, requires repeated requests and medical confirmation. Portugal, legal since 2023, recently passed legislation with safeguards. Luxembourg, legal since 2009, similar to Belgium and Netherlands. New Zealand, legal since 2021, approved via national referendum. Australia, legal in most states. Terminal illness within 6 months. Prognosis, strict eligibility rules. Okay, Ecuador, legal since 2004. Constitutional court ruling. Switzerland, legal. Passive only assisted suicide allowed if not for selfish motives. Okay, then you've got the United States. Physician assisted dying is legal in 11 states and DC, including Oregon, California, Washington, and Colorado. Patients must be terminally ill, mentally competent, and residents of the state. Most require multiple requests and confirmation by 2 clinicians. Countries where assisted dying is illegal or illegal. Most of Africa, Asia, and Eastern Europe prohibit both active and passive euthanasia. India, Germany, and the UK allow passive euthanasia, withdrawing life support, but prohibit active intervention. In many places, assisted suicide remains a criminal offense, with penalties ranging from fines to imprisonment. Key legal distinctions. Active euthanasia, doctors administer lethal dose. Legal in 10 countries. Physician assisted dying, patients self administer prescribed medication. Passive euthanasia, withdrawal of life sustaining treatment, widely accepted. Okay. Would you like to explore how these laws intersect with cultural attitudes, aging policy, or ethical framework, specific regions? I can also help you map implications for rural communities or marginalized populations. The ethical debates around assisted dying are rich, complex, and deeply personal, intersecting with medicine, law, religion, and cultural values. Here's a structured synthesis of the major ethical transitions, drawing from global discourse and recent scholarship. Core ethical tensions: autonomy versus sanctity of life. Proponents argue that individuals have the right to choose the timing and manner. of their death, especially in cases of terminal illness and unbearable suffering. Opponents emphasize the inter- internastic value of life, warning that legalizing assisted dying could erode respect for life and normalize death as a solution. Compassion versus normal offense. Supporters frame assisted dying as an act of mercy, relieving suffering when no other options remain. Critics critic critics invoke the principle of uh, normal lifing, do not harm, arguing that helping someone die contradicts the physician's role as a healer. Justice versus vulnerability. Advocates highlight fairness. If patients can refuse life sustaining treatment, they should also be allowed to choose death. Detractors worry about coercion, especially among the elderly, disabled, or those who feel like a burden, raising concerns about consent and societal pressure. Key arguments for dignity and control enables patients to die on their own terms, preserving dignity. Relief from suffering offers humane option when palliative care fails. A consistency in rights aligns with existing rights to refuse treatment or sedation. Key arguments against slippery slope. Legislation may lead to broader, less ethical applications, e.g., for non terminal conditions. Impact on medical ethics could undermine trust in healthcare providers and shift medicine's focus from healing to ending life. Social messaging may send implicit or implic signals that some lives are less worth living, especially for marginalized groups. Emerging ethical questions. Cultural and religious diversity. How do we respect puristic views on death and dying, mental illness, and non-terminal conditions? Should assisted dying be extended beyond physical illness? Safeguards and oversight. We can truly ensure voluntary informed consent in all cases. If you'd like, we can explore how these debates play out in specific communities, like like rural, uh, elders, caregivers, or culturally diverse populations, and co-design ethical frameworks that reflect both autonomy and equity. The legal the legal implications of assisted dying are multifaceted, multifaceted, touching on constitutional rights, met- medical liability, and regulatory oversight, and involving evolving definitions of patient autonomy. Here's a structured breakdown of the key legal uh, determinations. Constitutional and civil rights. No universal right to die. The U.S. In the U.S., the Glucksberg 1997 that physician assisted suicide is not a constitutionally protected right. State level protections. States like Oregon, California, and Vermont have enacted laws that permit medical aid in dying, are made, framing framing it as a matter of personal liberty and dignity. Guys, when people have terminal illnesses and they know the outcome, all it is about being pain free and having the right to choose how they want to go because they already know they're going to go anyway. So, in my mind, if you have sound mind and can make informed decision about that, and if you can take and if you have the right documentation with all the paperwork covered, and everybody knows that um that takes care of you. Everybody knows that you have the same illness, that it's not going to change, that you're going to get worse. You have the option to go, or in some cases, people end up like vegetables. Um, if you have the right to choose, if you have the right documentation, if your illness is not going to get any better, if you're going to end up going anyway, being having dignity at the end matters for people. That's my point on it. People have to have dignity going out. If they're already sick, if they're having, if they have a terminal illness that they're not going to get any better with, then, if they have the right documentation, have, a physician sign off on it. If they're in a state that, legalizes it, if they have the proper channels all covered, um, it's their right. If they have it all documented right, if it's all legalized, then if someone wants to do that in a legal state, in my mind, they should be able to, because the illness is not going to get any better. It gets worse for people. Um, it's a personal issue that is a debated one every time somebody thinks about it. But in my mind, if someone has a terminal illness, it's not going to get any better. And if they have everything documented, if they jump through the hoops for every that the state that they live in, if it's legal in their state, why not go? My feeling is if someone's dying, go out with some dignity. You know, um, be it be it hospice, end of life. It has a two-sided coin. Um, the profession of end of life is there for people that have terminal illnesses. We we give them the best end of life care we can. We give them as much. We make their life as much as we can, enjoyable, towards the end as we can. But again, if someone has their mind, if they have everything in order, and if they know how long they have, it's much easier to tell somebody to go to sleep. I don't want to be in a, it's like somebody telling somebody else, please put me to sleep. I don't want to be in any pain. That's their right at the end. Um, Nobody wants to suffer when they have a terminal illness. Okay, I'm going to finish the rest of this for you. Okay, next page. Medical and liability and professional ethics. Clinician protections. In jurisdictions where MAID is legal, physicians and nurse practitioners are shielded from criminal or civil liability if they follow uh, statutory protocols. Scope of practice. Recent laws in Colorado and Delaware have expanded MAID roles to include advanced practice providers, e.g., nurses, practitioners, raising questions about training, oversight, and ethical boundaries, documentation, and consent. Legal frameworks require religious documentation, multiple requests, and give me 1 second. Psychiatric evaluation. In some cases, to ensure informed consent and mental competence, mental health and capacity assessments, psychiatric evaluation, as MAID expands to include non-terminal conditions, mental illness. Legal systems must grapple with how to assess decision-making capacity and protect vulnerable individuals. Guys, so there are legal hoops that people must jump through. It's not just, let's go and do end of life because my illness is bad. You have to do the proper channels, folks. You have to get the legal documentation. You have to be of sound mind to take the medication. It has to be done legally. So that's my point on that. For now, Gator Wellness, take care, folks.